So, hello everyone. We're here to talk about natural alternatives for pain relief in our pets. Although there are a lot of medications that are used, there are often better ways to approach pain, and we want to kind of explore those today. So, um, I've been a holistic veterinarian for over 20 years. Actually, it's over 40 years. And I do a little bit of everything. We do Quest bioenergetics, we do ozone, we do thymus, we do a fair amount of CBD and a lot more all the time. We do deer antler, green lip mussel, and we're going to talk about a lot of these while we're on this subject today. So this is my son, who was a football player. If we have a few minutes at the end, I'll tell you about him. But these are the things I use when my family needs help. So the 5 cardinal symptoms of inflammation are heat, pain, redness, swelling, loss of function. And those are the called the 5 cardinal symptoms. And there's 4 overlapping stages. That first of all, you see some kind of an infection or some kind of tissue damage. Then you get specific cells, primarily fibroblasts and white blood cells that are called to the troubled area. We eliminate the source of the damage, and then we have resolution of inflammation. That is the natural progression of inflammation. And we recognize that there's kind of a tier of things that happen, some going from comfortable to, a little bit uncomfortable to very uncomfortable. And, often we don't even treat them in the first phases because we fail to recognize it. But if we are giving them an analgesic and we are not having progress with that, we need to start reassessing. And down at the bottom of this, we have dogs and cats that are constantly in pain, horses, whatever they may be, that are in constant pain, and we need to reassess if they're not improving. And honestly, that's where we get a lot of our patients, is when they're not responding to anything. So let's talk about conventional therapeutics. Antipyretics are for fever, and we Tylenol, aspirin, whatever it may be. We give them because we have been trained to think of fever as being pathological, when in reality, in humans, the defense mechanisms in humans run 10 times faster at 103 degrees. So when we interfere with that, we may be stuck with whatever the body has to put that virus or bacteria or whatever. It has to partition them and stick them somewhere, usually in the mesenchymal space, so they can come back and haunt us later. If you look at like cancers, a lot of cancers have been associated with viruses that we probably did not let run its course naturally. Non-steroidals have been used for a long time, the aspirin being probably the original non-steroidal. And it may be dramatically improved pain, but you get a significantly decreased response in healing, because those byproducts of inflammation, those cytokines, are what tell the body to bring stem cells in and to start regulating. That's what heals. There's a lot of research on this, and other things that can occur are gastrointestinal distress, cardiac issues in humans, think Vioxx and Celebrex, and liver disease, think of Rimadyl in dogs. So opiates are a big subject because, and there is merit in them, in using injectables. My son had injectable opiates and short-term opiates right after surgery, but they have some diversion risks, and they can have some horrible side effects over the long term, constipation and other things. So drugs like fentanyl, hydromorphone, codeine, buprenorphine, etc. And then tramadol, even though it's probably one of the most used drugs for pain, has actually, according to the AHA, does not appear to be effective in managing either post-op or arthritis pain. So, but it's still commonly used. So what are our options then? So the integrative point of view is that we want to aid the body in its quest to take those toxins out of the system. All of those inflammations actually are occurring in the matrix space, or the mesenchyme, which is like the gel between the cells, if you will. So we want to augment the defense mechanisms and the repair systems. So as far as musculoskeletal and neuropathic pain goes, arthritis, trauma, dysfunctional states, Those are the things that we probably see the most. That's what that we associate pain relievers for, although there are many other kinds of pain. So chronic pain is a complex syndrome, and it eventually gets a central component. In fact, the brain resets the pain centers, and sometimes you actually have to target that. And that's one of the places where CBD can be helpful, is because you get some targeting in the regional complex, the central component. So you get this kind of vicious cycle of inflammation, and they feed each other. And unless you address all the steps, like for example, if you have spasticity and you don't address the spasticity, then you still have one component of that neuropathic or musculoskeletal pain that persists, or if you have poor microcirculation. So homotoxicology, which is a branch of complex homeopathy, we've been using that for probably 30 years now. And then other natural pain relievers can actually approach that with a comprehensive method of kind of addressing all of those components. So these are the two most commonly used that are still available actually in the United States. Zeal is for like chronic degenerative disease, arthrosis, osteoarthritis, dysplasias, osteochondrosis. They've actually done a Tramiel study, or a Zeal study, excuse me, a Zeal study in dogs that showed that it clearly improves medical outcomes. And it actually has stem cells in it, or some homeopathic stem cells in it, which is pretty remarkable when you think about when it was developed, probably in the 30s and 40s. Tramiel has many scientific studies. It was in the PDR over that says 60, but I'm going to say it's probably closer to 80 now. There has no known drug interactions. You can use it virtually with anything, and they know that it modulates biochemical pathways like interleukin and TNF alpha. CBD is powerful, non-toxic. It has non-psychoactive. It's an anti-inflammatory. It's a natural pain reliever. It does a lot of other things. It's well tolerated, no serious side effects at prescribed doses, and it stimulates the endocannabinoid system. It is the endocannabinoid system is in virtually every cell of the body, so it can downregulate the global anti-inflammatory responses. So there's many studies that have shown that CBD can reduce inflammation in the joints caused by arthritides or dysplasias. It can also reduce inflammation in other parts of the body because, as I said, there are receptors in every part of the body, so every cell. So it even can be downregulate the brain inflammation, which is why it has some indications for seizure disorders. And there's a lot of patients with refractory seizures that will respond admirably to CBD. So deer antler is another thing that I like a lot. There are many kinds of collagens in it: hyaluronic acid, chondroitin, glucosamine, prostaglandins, fatty acids, glycosaminoglycans, phospholipids, and lots of minerals. There are lots of growth factors in deer velvet, that like nerve growth factor, bone growth factors that kind of give a clue as to why it has regenerative potential. If you think about it, deer antler is the only mammalian tissue that regenerates every year, and they'll literally go from a blastema to a huge rack. They grow at the rate of like an inch or two a day. So it can act as a joint lubricant, relieve pain, supports soft tissue, tendon, ligament, rebuilds joints, improves muscles, promotes bone growth. It has some improvement in vitality, improves cardiovascular function. It reduces hypertension in some patients, promotes cell repair. It's just a remarkably good supplement. And we actually have seen it as far as the coat. We have actually seen dogs with alopecia X, which is a genetic hair loss issue, that have grown coats back. So that's pretty amazing because there's really nothing that's very consistent. And we've had several animals grow coats back. So green lip mussel changed the way I practice medicine in about 1983. It has 9 glycosaminoglycans. They've actually used the components in green lip mussel to build scaffolding to grow stem cells. It has 53 fatty acids, 3 of which this omega-3, EPA, DHA, and this ETA is a novel fatty acid, which is like 350 times more potent than salmon oil as an anti-inflammatory. You can actually buy that as an extract, but as far as I'm concerned, it makes more sense to me to take a full plate, offer the body what it needs and let it pick what it needs. So it can relieve joint pain, stimulate cartilage production, improves joints, protects the GI tract, keeps free radicals down, and reduces joint inflammation. Years ago, I had a terrible shoulder and I took nonsteroidals for about 6 weeks, and it wrecked my gut, absolutely wrecked my gut. And when I started taking the green lip muscle, my crunchy fingers quit hurting, my knees quit hurting. I had a really bad knee. I got kicked by a colt when I was in vet school, and that knee killed me. And the only time it bothers me now is when I ride and the saddle torques my knee. But it's an amazing supplement. When we first started using it on dogs, we'd have people say, I don't know what the dog's taking, but I want some of that. We sell a lot of green lip muscle for people. So it's anti-inflammatory. It does not wreck the gut. The worst part of it is when you first start taking it, if your gut is bad, you can sometimes burp it. But unless you're allergic to shellfish, it's a no harm strategy. It does not change platelets. It can reduce gastrointestinal irritation from nonsteroidals as part of what helped my gut. It can selectively block COX-1 or COX-2 and LOX rather than the COX-1s. That is the ETA, icosahexatetraenoic acid. So it improves the microbiome. That's relatively new work, but that's pretty important because we get more and more information about the microbiome these days. So for GI pain, like infections, viruses, parasites, medications that create irritation like nonsteroidals, constipation, heartburn, these can all be improved with natural things like colostrum is one thing, which also has a range of stem cell type factors, growth factors, antiviral factors. It's just an amazing supplement that can be useful in our everyday, with our animals every day. So frankincense and boswellia are just 2 of the many herbal type things. Frankincense is actually not an essential oil. It's a rosin that is distilled from the boswellia tree. It's been used since it's written in the Bible, so it's been used historically for a very long time. It has whole body effects, including arthritis, IBD, Crohn's disease, and it has evidence of anti-cancer activity. So that's an interesting way to approach pain. So a few of my favorite supplements would be like the Heal BHI products, BHI Arthritis, which is still available in the US, has leadum in it. So it's actually kind of useful for tick diseases. We had a guy with chronic Lyme years ago, and he said that was the only thing that helped his arthritis. Zeal, Trameal, Rhododendron also has leadum in it, and we also use that for tick arthritis. Discus comp is not freely available in the US, but it is remarkable in that it has numerous stem cells in it. We use it on some really, really tough cases sometimes. Glycoflex products, some are over the counter. Some of the really good ones are practitioner only, but they're well worth looking at. Mobility Flex, Vetriflex, a lot of our really difficult ones, those are the ones we go to first. Chiasenix Prime is a thymus colostrum combination, and you can hardly go, that's an entire lecture by itself, but thymus extracts can be remarkable in down regulating inflammation. The Deer Velvet products we just talked about, the frankincense, boswellia, colostrum. Amylextin is a VetriScience product. It has a couple of botanicals in it, and this is an N of 1. So, we got one patient that is 2 years out now on Amylexin with a supposed bone cancer. It certainly looked like it was growing like it. So, they have anti-cancer properties, but there hasn't been a big trial, but something worth looking at. CBD also is an excellent adjunct, has anti-cancer properties well worth looking at. Human product that we use a lot is Phyto Ultra Comfort, which has some botanicals and DL-phenylalanine. It's a really nice product and has done really well in animals for those really kind of difficult, sticky ones. All right, so skin. Oh, don't we know? we see our failures when the skin does not improve. So we've got hot spots, bug bites. Flea antigen is a horrible antigen to deal with. They leave saliva under the skin. That's what they're allergic to, and it's very difficult to move that out of the mesenchymal space, so they can drive you crazy. Lesions, cysts, tumors, there's all kinds of things that manifest themselves on the skin. So holistic remedies for skin and GI, when you look at most of the atopy allergies in dogs, there's a big gastrointestinal liver component to that. You have to address those. That's a whole lecture in and of itself. But ozone can be remarkably useful, omega-3 fatty acids, blood therapies, another lecture all by itself, but that basically uses the blood and you give it back either as an injection or orally or both. That is body-specific immunotherapy. Detoxification, got to get the trash out, but you've got to be able to move that. The body has to be able to move that. The blue-green algae, I am a huge fan of. We've been using it since 1995. It's a subject all of itself. Enzymes between meals can be remarkably useful because they help the body break down the proteins that have gotten through the space they shouldn't have gotten through. Probiotics, we talked briefly about the microbiome. It's a huge subject, but microbiome is a big factor in many things that we deal with. Keo Prime is thymus colostrum. Pentagenesis is a 5-part deer velvet and perna combination. Just went to a series of lectures on high dose vitamin D. We're going to be doing some kind of in-clinic looks at that here pretty quick. Liver support therapies, like I said, the liver's not running. You can't get rid of the trash if the liver's not running. Glutamine and glycine for repair of leaky gut. And full spectrum hemp salve. We've had pretty good luck with that on some of our skin issues. So let's look at a few stories, because that's always what is what convinces you whether you're going down the right path or not. So this is a chronic allergy dog, and her name is Mitzi. She's a delightful dog with a delightful owner. We actually ran a quest on her and found some kind of interesting things. Her owner smokes, and the quest came up with nicotine toxicity on this dog. But her treatment has kind of varied because she has, the owner keeps going back to feeding bad food. And so every time she does, she kind of flares back up again. She's had fleas a couple of times. And she's an older dog and has chronic stuff. So she's been on Penta, the blue-green algae combinations. We've done lime dip when she was really miserable, yeasty kind of things. Lime dip is hard to get these days, but it works really well for some of those yeast and Sarcoptes dogs. Blood therapy, dimethylglycine. Dimethylglycine was probably the second supplement I ever used. It's a huge detoxifier. It has lots and lots of things that the body does, including detox you from viruses sometimes. Keo Prime, which is the thymus colostrum. The dog's on thyroxine. She is pretty clearly hypothyroid, and she gets ozone baths, and we change her diet, but sometimes she just doesn't stay changed. So that's a before and after of Miss Mitzi. Mystique is in case you're wondering if you can do all these things in horses, in 2019, she was 18 years old. She had an intermittent lameness, usually in the fall. This horse probably has, besides having the worst feet of any horse I've ever owned, she also probably has EPM. So she goes through a neurological phase every fall. So we suspect equine protozoal myelopathy on it, and we treat her with autologous blood therapy for that. But we use pain medications, Perna, isoxaprine to improve the blood supply. That's a little hard to get these days. And in the past few years, we've added CBD to the thymus and autologous blood therapy, and this is what she looked like. Most of the time she laid down, but she's shifts her weight completely to the back. You can see how painful she is. So this was 4 months into treatment in 2019. So you can see the difference in her mobility. So she also has, in addition to that, because she's a pale horse, she's got photosensitization and a contact dermatitis. because the Langerhans cells are part of the immune system. They're damaged with UV light and with glucocorticoids, unfortunately. So they play an important role in the skin response. So we do a body-specific immunotherapy. That's the nice thing about immunotherapy. It treats whatever's going on. So that's how we treat a lot of our atopic dogs. And, a topical CBD ointment could be really useful for these guys. This is what it looks like. This is not her on the left-hand side, but that's kind of what it looks like, only you can magnify that about 10 times. And then you take a look at her muzzle, and in these other pictures, you can see how much she improved with the blood therapies and supplements. So Sunny was a 3-year-old Australian Shepherd when this occurred. She was spayed, and she had an acute onset of lumbar pain. We really don't know what started that, but she's a maniac, so it could have been anything, and some kind of an unknown trauma. We did test her for Ehrlichia because we are the Ehrlichia capital of the world here. In 2013, we ran an 80% positive on Ehrlichia dogs. So we gave a blood therapy on her of Traumeel, placenta comp, echinacea comp, and the thymus extract as an autosanguis. And since that time, she's had cruciate damage, and we've managed her entirely these years with Homotox, CBD. She's on deer antler, Perna, etc. We added Perna to her, or CBD to her regimen recently, and it really, probably a year ago, and it really has made a difference. So initially, I had to carry her into the clinic. She was so bad, and she's a tub of lard, so it wasn't fun. Every veterinarian should have a fat dog. It's embarrassing, but she scavenges. So this was an hour after the thymus autologous blood injection. The tail works, but so she's better than she was when I brought her in, but she literally can't get up. She's a little better than she had been, but she was still, you can tell she's miserable. All right, so this is 3 hours after the injection. She has to rock. But she got up. Now this is 24 hours later. And that was the dog who could not get up the morning before. So, we can just see some really, really remarkable things. And, it sometimes it's a mixture of things. I had one dog that was 3-legged lame and absolutely could not move. And Perna, in 24 hours of Perna, he was significantly better. 48 hours, he was off and running. And that's how we got, using things like that, because if they work, then you want to know why they work. And we use things that work. And there's a lot of ways to get around treatments. So, hold on. All right. So the main takeaways then are, we can do it for prevention, or we can do it for pain. We have deer antler, we've got green lip mussels, we've got colostrum, we've got herbals, ozone therapy, zeal and traumeel. So there are a lot of ways to approach pain from a really natural standpoint. Virtually no side effects in any of those things. We just don't see them. So I'm going to make a quick, I said I'd tell you if I had time at the end about my son. He was a football player, and in the last game of the season got taken out at the knees, and he ended up with no ACL. It was pulled off of both surfaces of the joint. The MCL had pulled off with a chunk of bone, and he had 3 meniscal tears because he ran for a quarter and a half and no knee. And so, they said, it would be, I told the surgeon when we saw him on Monday that he wanted to play baseball his senior year. And the surgeon said, there's no way. There's just, it's 6 months. Well, and then of course he's writing a script for Celebrex, which we refused. And he was on the baseball field in 12 weeks. He was taking Perna. I didn't know about deer velvet, or we would have been using that. I didn't know about CBD at the time. Well, it was also probably illegal at that time. Or we'd have been using that as well. And he did do a platelet-rich plasma, PRP injection, first time he'd ever done that on a patient. But yeah, he started in his first game of the season at 16 weeks, but he was playing baseball at 12 weeks after that kind of a devastating injury. So if you don't interfere with healing, if you don't, when I was in vet school, they had a study that showed that butazolidine, which was one of the original nonsteroidals, retarded bone healing in racehorses. So you reduce the pain, but at what cost? So I suggest that you kind of look at these other products, these other types of approaches to pain, and see if we can improve their quality and quantity of life with things that are natural and have no side effects. So thank you all for your attention. If you have any questions, feel free to contact us.